Good morning, good afternoon, wherever you might be. So today we will be talking about this Omicron variant as a way of updating ourselves on Covid-19. And as we mentioned, my name is Walter Jaokos. I'm a professor of medical microbiology and tropical medicine at University of Nairobi. Now, the way we are going to discuss today, I'm going to just give a quick review of what COVID-19 disease is, and then delve into the issues of variants, and then specifically come to this Omicron variant. And when we come to Omicron variant, we'll be asking ourselves the question, what is it, and what is known about it? So just as I always like starting from what COVID is. Now, this is a virus that is causing the current COVID pandemic globally. It's called a SARS-CoV-2. It's a coronavirus, and the reason why it is called a coronavirus, it looks like a crown with all these squarish, brownish looking structures, which are very important. They're called the spike protein. So it makes the virus look like a crown, and that is where it gets its name, corona. Now, it is not the first coronavirus that is affecting human beings. Coronaviruses usually infect animals, but then they cross over to infect human beings, and that is where the problem is. Now, SARS-CoV-2 is called SARS-CoV-2 because there was a SARS-CoV that occurred in 2002. At that time, we didn't know that we were going to get another SARS-CoV, so it wasn't called SARS-CoV-1. It was just called SARS-CoV, and it spread to 24 countries before dying out. And then the other coronavirus was called MERS-CoV. MERS-CoV stands for Middle East Respiratory Coronavirus, and that had an outbreak in 2012, spread to 27 countries, resulted in about 900 deaths, and then it died off. Now, the current coronavirus that we have started in December 2019, and so far, it has spread all over the world. There are only 4 countries in the world that have still not recorded cases of COVID. One is North Korea, and possibly they might be there, but it's a closed country, so nobody knows for sure. Another one is an Asian country known as Turkmenistan. And then there are 2 countries in the South Pacific that have not reported COVID-19. But all the other countries so far have been affected by this COVID-19. So to date, more than 300 million people have been infected globally, and so far it has resulted in more than 5 million deaths. Now, this is the animal that was responsible for the original SARS-CoV that occurred in 2002. As we say, these are infections that infect animals and then cross over to human beings. So for SARS-CoV, it came from this animal known as the palm civet in 2002. And we are predicting that it probably might be associated with increased transmission or severe disease or immune escape or diagnostic difficulties or treatment difficulties. And then it is being seen in multiple countries, in multiple sites, and therefore we think it might have a global public health concern. Then we call it a variant of interest. But then what is a variant of concern? Now, a variant of concern is when you have this variant of interest characteristic, but then in addition to that, it is associated with one of the following. Now, it is not just the changes that you have seen on the surface, what we call the mutations, but now you can see that it has potential for increased transmissibility, or you suspect now that there is an increase in virulence of the disease presentation might even be different, or that there is a decrease in effectiveness of public health measures that we normally use to control it, including vaccines. Then we now call it a variant of concern. It's important that you distinguish those two. Now, currently, the variants of concern that have been described by WHO include the following. One was the Alpha variant. We started with the Wuhan variant. Then we went to the Alpha variant that was first identified in the UK. And then shortly after that, we had the Beta variant that was identified first in South Africa. Then we had the Gamma variant that was identified in Brazil. Then the Delta variant that has been ravaging the whole world, that was first identified in India. At some point, there was some talks about a Delta plus variant, but it did not reach a level of variant of concern. And now currently, we have the Omicron variant, which was first identified in South Africa and Botswana. Now, how the naming of these variants is based on the Greek alphabet. So why is this one called Omicron? If you look at the Greek alphabet, it starts with alpha, beta, gamma, delta, and so on. The next two Greek alphabets were Nu and Z in the Greek alphabet. But now Nu was skipped. Why was Nu skipped? Because it can confuse with new. So WHO did not want people to confuse this variant with a new virus. So they skipped Nu. The next Greek alphabet was Z, but Z was skipped because it's a common Chinese name. So for example, the Chinese premier is known as Xi Jinping. And so WHO did not want to have any offense to cultural, social, national, or ethnic groups. And the next Greek alphabet after Z is Omicron. And it is for that reason that the current variant of concern is called Omicron. Now, what is this Omicron? Now, if you look at what has happened in other countries, so for example, if you look at England, for example, in the UK, the grey variant was the Wuhan variant that started, and then at some point they had the Alpha variant that was first identified in the UK, but then when Delta variant came, it displaced every other variant before it. So now the whole of the UK, the variant that is circulating is the Delta variant. If you look at South Africa, this is what happened. We started with the Wuhan, the original strain. Then we had the Beta variant that was first identified in the UK, in South Africa. But then when the Delta variant came, it displaced all the other variants. So now the dominant variant up to recently in South Africa has been the Delta variant. If you look at Brazil, Brazil started with the Wuhan variant, and then as we said, the first country where the Gamma variant was identified was in Brazil. But when the Delta variant came from India, the first place where it was discovered, it came and displaced all the other variants. So now in Brazil, the dominant variant is the Delta. And we end with this. So this was in India. Again, it started with the Wuhan one, and then it was displaced by the Delta. Now, if you look at the globally now, if you were to do all the sequencing of the variants that are being circulated in the world, many countries is 100% Delta. So if you look at France, Australia, Austria, Italy, the United Kingdom, and up to recently South Africa, so this was by September this year, it was only Brazil that had about 93% being Delta, but they still had a bit of it being the Gamma. And that is why it was first described. And also Canada had just about 2% being Gamma, but the majority of it was Delta. So this picture tells you that Delta variant came into the world and it displaced all the other previous variants. Now, this is the picture now as of to date. And if you look at this now, the color in red is the Omicron variant. So the United Kingdom are still largely Delta still. The United States has been Delta and all these other countries. But then you start seeing in Germany, Omicron has started displacing Delta. The same with Canada. Now it's about 3% of the sequence cases are Omicron. Australia also about 3%, Botswana about 6%. But if you notice now, in South Africa, 89% of the new cases that are being diagnosed Omicron. Now, this is what has caused a bit of concern in the world. The question that we've been asking, is Omicron the variant that will come and displace the Delta variant the way Delta variant came and displaced all the previous variants? So what is this Omicron variant? Now, Omicron variant has been named, it's a B11529, you don't need to remember that, but it is the genetic name that has been given, number that has been given. It was first identified in South Africa on November 25th. It's actually disputable whether it was first in South Africa or first identified in Botswana, because the samples were from Botswana and from South Africa. To date, by yesterday or today, there are 38 countries that have reported Omicron. Now, in some countries, it has just been identified amongst travelers, like Saudi Arabia, Belgium, Nigeria, Ghana, Israel, and many other countries. But there are some countries where there is evidence of local transmission. By this we mean there are people who have not got into contact with anybody, who have traveled from Southern Africa, but you find that they have got Omicron. And this has been identified in the UK, the US, Canada, India, Spain, Australia, Germany, Norway, Iceland, and a few other countries. So this is now the picture that we can see. The places that are marked brownish is where you have evidence of local transmission, and the places where it is marked light brown is where it has been detected in travelers. But what is it? Now, researchers have found, originally they'd seen about 30 mutations, but now there's evidence that there could even be up to 50 mutations on the spike protein. Now, this is important. The spike protein is the triangular structure that I showed you at the beginning of my presentation that the virus uses to attach onto a human host and therefore infect the body. Now, all the vaccines, most of the vaccines that have been used currently have used these spike proteins to be able to develop what you call an immunogen. What is then injected into you, and then your body sees it and produces antibodies to fight the suspected infection. Now, many mutations raise possibility that the variant might escape either the current natural immune responses that are generated after becoming infected and recovering from infection, or that are generated after getting the vaccine. And if this happens, there might be reduced efficacy of treatment, even with antibodies. You know, there is something called use of what you call convalescent plasma, where somebody who has become infected with COVID-19 and recovers, you can take their blood, develop something called plasma, and use it to treat people with severe infection, because their plasma has antibodies against the virus. So if there is enough mutation on the surface of the spike protein, then we'll not be able to use convalescent plasma using antibodies to treat people with severe infection. The other thing is that if there is sufficient changes on this spike protein, it might even be so much that it might avoid detection using the current diagnostic techniques that we have. These are concerns. The concerns, therefore, is the question that the researchers, scientists, all over, and governments all over the world have been asking themselves: what if this Omicron is more dangerous than the previous variant? So far, the most dangerous of the variants that we have has been Delta, and as you've seen, Delta has displaced all the other previous variants. So what if this Omicron is more dangerous than the Delta variant and displaces all the other previous Delta variant, wherever Delta variant is prominent? Now, Delta quickly overtook all its predecessors in the world. Delta is more transmissible than all the other variants. Delta is possibly causing more severe disease in unvaccinated people than the previous variants. But at the moment, there is no evidence that Omicron is more lethal. In fact, it seems to even be less lethal than the Delta variant. And if this is proved to be the case, it is actually a good thing that you can have a less lethal variant coming to displace the more lethal Delta variant. And yet studies are still going on to show whether this is the case. At the moment, there is no or little evidence that the Omicron variant will outsmart the current COVID vaccines that are being used globally. Now, the concern that came was this picture. If you look at the infections that we were having, these are the three waves that have occurred in South Africa. By the beginning of December, the infections were really going down. And then they started rising up with the emergence of the Omicron variant. So one thing we know, it seems to be that the transmission of the Omicron variant is actually more aggressive, and it is responsible for the third wave in Southern Africa. And as we've explained, specifically now coming to South Africa, it is the Omicron variant is already the dominant form of the virus. We have seen a sharp increase in COVID cases in the last 1 month. What we have also noticed is that there seems to be an increase in the number of cases of people who have already previously been infected and recovered. As you know, that people can become infected, be reinfected with COVID virus more than once, but the numbers usually are much less compared to what we are seeing now with the Omicron variant. We also know that it seems to be spreading much faster than the Delta variant. What we also know is that it seems to be causing milder illness compared to the Delta variant. The Delta variant, as you know, had severe presentation, including loss of taste and smell. But the Omicron variant currently seems to only be presenting with cough, sore throat, but not with difficulties in breathing, no loss of taste, and no loss of smell. These are early or preliminary findings that we have. We need to be able to gather more information to prove that that is the case. However, again, the number of people who are being infected in South Africa, mainly young people, who are less likely then to become severely infected. The question we ask ourselves is, what if Omicron begins to infect the older population? Will the symptoms remain as mild as being seen currently? We also know that most of the people who have been hospitalized with Omicron are people who have not been fully vaccinated. Now, what about vaccines? Because this is a concern for the world globally. It is unlikely that the Omicron variant will not respond to COVID vaccines. And this is because the vaccines that have been developed for COVID stimulate two arms of the immune response in the body. It produces what we call antibodies that fight the infection, but it also produces what we call T cells, the cellular immune response, which produces white blood cells that attack the virus-infected cells, in the process killing both the virus and the infected cell. So because mutations are happening in the spike protein, it might blunt the antibody response, but it is not possible for it to blunt the cellular response, what we call the T cell responses. Thus, it is envisaged that the vaccine will continue to work, either partially, even if it is affected, or it will work fully. Because if it is affected, if the immune response to antibodies is the one that is affected, the cellular arm of the immune response will still be there, and so the vaccine will only be partially affected. And that has been seen with the previous mutations. So for example, in South Africa, when the beta mutant was found not to be responding to the vaccine, it wasn't that the response was zero, it is only that it was lowered. And one of the things we know for sure, that in regard to preventing severe disease and death, the vaccines work irrespective of the mutation. So unless Omicron becomes different, that is the experience with all the other variants. So what should countries do? That is a question that many countries are asking themselves. So countries should continue to enhance surveillance, what we call surveillance, keep on sequencing any new infection that they have so that we can better understand the circulating variant. As you know, as long as the virus is being transmitted, we will continue to see mutations, variants being developed. Because as long as the variant moves from one person to another, it keeps on making mistakes, it keeps on changing its surface, so we will expect to see more variants. Now, we then also need to report initial cases or clusters of infection in our respective countries to WHO. And in this regard, South Africa should actually be commended for being a country that does a lot of sequencing and alerting the world that there is a new mutation. South Africa should not be condemned because they are the first ones to identify the variant. The fact that you identify a variant in a country, it doesn't mean that it started there. This always reminds me of the HIV epidemic when it started. You remember when the HIV epidemic started, many countries developed a system for screening pregnant women to see whether they are infected so that they could be able to prevent mother-to-child transmission of HIV. And in many situations, when the woman would test HIV positive, they were blamed for having brought the HIV to the house because they tested first. And it is the same situation we are now seeing with COVID-19. The fact that a country identifies a variant first, it doesn't mean that that country is the one that originated that variant from. There are many countries that are not doing as much sequencing as South Africa is doing, and therefore we should not blame South Africa for being a source of the Omicron virus. It's not true. So each country should continue to do investigation, they should continue to do laboratory assessment to improve the understanding and the impact of any new variants, not just Omicron. And then the world globally, we should address the inequities of access to COVID-19 vaccine. Because if we vaccinate people everywhere, transmissions will be reduced and development of the virus will greatly reduce. And it is the sure way of stopping development of virus. But what should we do as individuals? This is a question I've been asked before. Should we change our public health measures? The answer is no. Wearing of masks, well-fitted masks, washing of hands, physical distancing, use of proper ventilated rooms if you're staying indoors or working indoors, avoiding crowded places, sneezing in the elbows and getting vaccinated are known public health measures that will stop transmission of any COVID transmitting virus, irrespective of the variant. So what are the ongoing studies? We are doing more studies as scientists to get more evidence to show whether this Omicron variant is more transmissible. We have some evidence from South Africa, but we need to see whether this is replicated all over the world. We also need to know whether there is any evidence developing that it might cause severe disease. At the moment, we know that the symptoms are less severe than the Delta variant, but we'll continue to observe and to do investigations to see whether that remains the case. With regard to vaccines, we still need to check and be sure that the vaccines are effective. What we know is that the vaccines remain effective up to now against severe disease and death from all the variants that have been identified so far, and we have no any reason to doubt that it will continue to remain effective against Omicron. We also need to check if there is any escape in detection. We know that the PCR test that we're using is able to detect all infections, including Omicron, but we are not sure yet about other tests like the antigen detection techniques that are being used also in clinical practice. We need to continue doing investigations and studies to see whether these other tests are also still effective in detecting Omicron variant. And with regard to the treatment, there is no change in treatment of COVID-19. It remains the same globally, but we need to keep on doing studies to see whether Omicron or any other mutant for that matter will still respond to the current treatment that we have globally. So in summary then, we have looked at what COVID-19 disease is, and it is caused by the coronavirus. We have also looked at the various mutants that have happened so far, beginning with alpha, beta, gamma, and delta. And now the new variant that we are calling Omicron, and why it is called Omicron. We've looked at what it is, and we've discussed what is known so far about it, even as we continue to get more information and studies are ongoing. I'll stop there, and those are some of the references that you can have later. And thank you, all the healthcare workers, for the work they do to keep us safe during this pandemic. I'll stop there and see if there are any questions that we can respond to. Thank you.